Hi, let's see about anemia today. We are going to see about the definition of anemia, types of anemia, causes of anemia, and signs and symptoms of anemia. Anemia is classified as the group of disorders in which hemoglobin concentration of blood is below the normal range for the age and sex of the subject. Therefore, anemia is labeled when the hemoglobin concentration is less than 13 gram per deciliter in adult male, 11.5 gram per deciliter in adult female, 15 gram per deciliter in newborn, and 9.5 gram per deciliter at 3 months of age. And the anemia is again further classified into mild, moderate, and severe, where the mild anemia is the range of hemoglobin in the range of 8 to 10 gram per deciliter, and in moderate anemia hemoglobin concentration will be there in the range of 6 to 8 gram per deciliter, and in severe anemia hemoglobin concentration will be below 6 gram per deciliter. So in this picture we can see the normal RBC and the anemic RBC count. So here we can see the scanty blood RBCs in the blood picture. And the anemias again broadly classified into two, that is morphological classification and etiological classification. Morphological classification is also known as Wintrop's classification, and etiologically it is also known as Whitby's classification. So coming to the morphological classification of anemia, morphological classification means it depends on the size and shape of the RBCs. So it is again further classified into four groups, that is nomocytic nomochromic, macrocytic nomochromic, macrocytic hypochromic, and microcytic hypochromic. Nomocytic nomochromic means where the size and color of the RBCs are normal but the number of RBC is less. The examples are in acute post-hemorrhagic anemia, hemolytic anemias, and aplastic anemias. Wherein macrocytic nomochromic anemia, that is the size will be bigger and the color of the RBCs is normal, that is increased MCV and normal MCHC, is seen in megaloblastic anemia due to deficiency of vitamin B12 and megaloblastic anemia due to deficiency of folic acid. And macrocytic hypochromic anemia, the size of the RBCs are bigger and MCHC is less, so the cells are pale and that is less colored cells will be seen in the bloodstream. And microcytic hypochromic anemia, they are characterized by reduced MCV and reduced MCHC and is seen in iron deficiency anemias. So see, under microscope we can see the RBCs in the normal RBCs. In the left diagram we can see the colored RBCs, where in the abnormal or the anemic RBCs are pale, and we can clearly see the paleness in the RBCs in the right picture. So anemia, simply we can say as a mnemonic like anemia of chronic disease, no folate or B12, ethanol, marrow failure, and hemoglobinopathies, iron deficient, and acute and chronic blood loss. So coming to the etiological classification, that is the study of cause or origin of the anemia. It is classified into hemorrhagic anemia, hemolytic anemia, nutrition deficiency anemia, aplastic anemia, and anemia of chronic diseases. Coming to the hemorrhagic anemia, hemorrhage is the chronic blood loss. Chronic or acute blood loss leads to anemia. That is the size of the RBCs are nomocytic and nomochromic, and if the person undergoes chronic blood loss or prolonged bleeding, that will causes microcytic hypochromic anemias that we can see in the picture. And hemolytic anemias. Hemolytic anemias are the anemias where hemolysis is present. There are two types of hemolytic anemias, that is extrinsic hemolytic anemia and intrinsic hemolytic anemias. So extrinsic hemolytic anemias are caused due to the liver failure, renal disorders, hypersplenism, burns, infections and all. Also by poisoning and autoimmune diseases. and the cells will be normocytic and normochromic in extrinsic hemolytic anemias, and where in intrinsic hemolytic anemia, that's mainly due to hereditary disorders, they are sickle cell anemia and thalassemias. In sickle cell anemia, the cells will be in sickle shape, and in thalassemia there are cells will be small and irregular shaped cells will be seen. Coming to the sickle cell anemia is due to the abnormal hemoglobin known as hemoglobin S. In this, the alpha chains are normal and the beta chains are abnormal in the hemoglobin. And coming to the thalassemia, there are two types of thalassemias, that is alpha thalassemia and beta thalassemia. Alpha thalassemia occurs in fetal life or infancy. In this alpha thalassemia, the alpha chains are less absent or abnormal, where in beta thalassemia, the beta chains are less or absent or abnormal, and there will be excess alpha chains will be present. And coming to the megaloblastic anemia, that is the part of nutrition deficiency anemia. So coming to the nutrition deficiency anemia, the nutrition deficiency anemias are caused due to the deficiency of nutritive substance which are necessary for erythropoiesis. So the nutrition deficiency anemias are iron deficiency anemia, protein deficiency anemia, vitamin B12 deficiency, folic acid deficiency, and aplastic anemias of bone marrow disorders. And coming to the iron deficiency anemia, the cells will be microcytic and hypochromic. In protein deficiency, the cells will be macrocytic and hypochromic. And vitamin B12 deficiency, the cells will be macrocytic, normochromic, or hypochromic. And in folic acid deficiency, the cells will be megaloblastic and hypochromic. We can see the nutritional deficiency anemias in detail. Coming to the iron deficiency anemia, that is the most commonest nutritional deficiency disorder or the anemia in India. And it is the prevalence is higher in developing countries, and in women between 20 to 45 years is more common than men, and the periods of active growth in infancy, childhood and adolescence, the iron deficiency anemia is most common in India. So they are taking adequate measure to manage this iron deficiency anemia. Coming to the iron requirement, only 10% of the dietary intake of iron is absorbed. Therefore, daily requirement in adult male is 5 to 10 milligram per day, and in female is 20 milligram per day. And it is absorbed mainly in the duodenum and in the upper jejunum, and is absorbed more efficiently in ferrous form and is transported in blood. So, the iron absorbed in blood, which binds with a beta globulin, that is also known as apotransferrin, to form the transferrin, and is transported in this form in the plasma. And iron is stored in the body in two forms, that is as ferritin and hemosiderin. And what are the causes of iron deficiency anemia? Iron deficiency anemia is due to the inadequate dietary intake of iron, increased loss of iron, increased demand of iron, and decreased absorption. There are some special characteristics for iron deficiency anemia, that is the nail become dry, soft and spoon shaped, known as koilonychia, that we can see in this picture. And again the tongue become angry red, that is also known as atrophic glossitis. And mouth may show angular stomatitis, that is the sides of the mouth will become inflammatory. And esophagus may develop their membranous webs at the postcricoid area, leading to dysphagia, and is known as Plummer-Vinson syndrome. And RBCs are hypochromic and microcytic. They show anisocytosis and poikilocytosis, that is the abnormal shapes, and the red cell indices like MCV, MCH and MCHC are decreased. The next nutritional deficiency anemia is megaloblastic anemia. They are characterized by abnormally large cells by erythrocyte series and is caused by defective DNA synthesis due to deficiency of vitamin B12 or folic acid. And there are two types according to etiology, that is megaloblastic anemia due to vitamin B12 deficiency and malabsorption of vitamin B12. The causes of vitamin B12 deficiency are inadequate dietary intake in strict vegetarians and breastfed infants, and malabsorption of vitamin B12 is happens due to the gastric causes leading to deficiency of intrinsic factors such as autoimmune cause of failure of secretion of intrinsic factor and is known as Addisonian pernicious anemia. And the malabsorption of vitamin B12 is also happened due to gastrectomy and congenital lack of intrinsic factor. And the intestinal causes which are associated with decreased vitamin B12 absorption are tropical sprue, ileal resection, Crohn's disease, fish tapeworm infestation, and intestinal blind loop syndrome. The Addisonian pernicious anemia, that is the anemia or the megaloblastic anemia due to vitamin B12 deficiency occurring as a result of failure of secretion of intrinsic factor by the stomach owing to an autoimmune atrophy of gastric mucosa. And there will be anti-intrinsic factor antibodies will be present in the serum. You can see the blood picture. You can see the nucleated megaloblasts are present in the blood picture. And megaloblastic anemia due to folate deficiency. The folate deficiency are caused due to inadequate dietary intake due to poor intake of vegetables as seen in poor people, infants and in alcoholics. Malabsorption, that is in celiac diseases, tropical sprue and Crohn's disease. Increased demand happens in physiological conditions such as pregnancy, lactation and infancy, and pathological conditions of cell proliferation such as increased hemoglobinopathies and malignancies. And effect of drugs such as anticonvulsants, contraceptive pills and certain cytotoxic drugs. And excess urinary folate levels will be there in active liver disease and congestive cardiac failure. And the features of megaloblastic anemia, there are specific features for folate deficiency are also seen, that is low serum folate level and low red cell folate level. And in this condition, the RBCs are larger in size, that is macrocyte, but contain a normal concentration of hemoglobin, that is normochromia. MCV is increased and MCH is increased, but the MCHC is usually normal because both MCV and MCH will increase. And the peripheral smear shows nucleated RBCs with marked anisocytosis and poikilocytosis, and there is increase in reticulocyte count more than 5%. And the lifespan of RBC is decreased and the WBCs and platelet decrease because of encroachment of megaloblastic tissues. Coming to the aplastic anemia, the aplastic anemias occur due to the failure of bone marrow to produce RBCs. There are two types of aplastic anemia, that is primary aplastic anemia and secondary aplastic anemia. And next one is the anemia due to chronic diseases. There are non-infectious diseases like inflammatory diseases, that is rheumatoid arthritis, chronic infections such as tuberculosis, chronic renal failure, neoplastic disorders, that is Hodgkin disease. And in chronic diseases, the cells will be normocytic and normochromic, and the tissue macrophages are believed to become activated so that the RBCs are removed from the blood faster than they are formed in bone marrow, and that is the reason why we are getting anemia in chronic diseases. And this is the nutshell of the type of anemia, its causes and the morphology. The types are hemorrhagic, hemolytic, nutritional deficiency, aplastic, and anemia of chronic diseases. And the causes for hemorrhagic anemia is acute loss of blood and chronic loss of blood. For hemolytic anemia, that is liver failure, renal failure, and hypersplenism, and so on. And intrinsic hemolytic anemia is due to the hereditary disorders such as sickle cell anemia and thalassemia. And nutritional deficiency anemia, that the causes are iron deficiency, protein deficiency, vitamin B12 deficiency, and folic acid deficiency. And aplastic anemia is due to the bone marrow disorders and chronic diseases. Anemia due to chronic disorders are caused by non-infectious inflammatory diseases like rheumatoid arthritis, chronic infections like tuberculosis, chronic renal failure, neoplastic disorders such as Hodgkin's disease. Coming to the symptoms of anemia, the general and most common symptoms are headache, insomnia, and shortness of breath, fatigue, dizziness, difficulty in concentration, and pale skin. In skin and mucous membrane, the color of the skin and mucous membrane become pale and is more constant and prominent in buccal and pharyngeal mucous membrane, conjunctiva, lip, earlobe, palm, and nail bed. And in cardiovascular system, there is an increase in heart rate and cardiac output. And in respiration, there is an increase in rate and force of respiration. It leads to breathlessness and dyspnea, and the oxygen hemoglobin dissociation curve is shifted to right, that is more release of oxygen will happen in anemia. And in digestive system, there will be anorexia, nausea, vomiting, abdominal discomfort, and constipation. And in pernicious anemia, there is atrophy of papillae in tongue, and in aplastic anemia, necrotic lesions appear in the mouth and pharynx. Coming to the metabolism, the basal metabolic rate increases in severe anemia, and the renal functions are disturbed and also known as albuminuria. In reproductive system, the menstrual cycle is disturbed in females, and there might be menorrhagia, oligomenorrhea, or amenorrhea. And in neuromuscular system, there are increased sensitivity to cold, headache, lack of concentration, restlessness, irritability, drowsiness, dizziness or vertigo, and sometimes they shows fainting while standing, and muscle become weak, and the patient feels lack of energy and fatigue quite often and quite easily. And for exams, we usually get questions like define anemia, give its classification, iron deficiency anemia, and megaloblastic anemia. And thank you.